have been so many changes and improvements in hearing care in the 21st century. It's not necessarily like what your grandma had years ago. That's why I'm at Now Hear This, talking with Dr. Philip Griffin to find out about some of those changes and how people can get the most for their money. Mm-hmm. Getting hearing care is an investment, isn't it?
It is, right. Whenever you get any healthcare service, whether it's braces or dentures or something, you're spending money and you want to make sure that you get some value for what you're doing. And the best way to do that is to go somewhere that provides a lot of value for what you're trying to get. In the case of hearing aids, it's getting the advanced testing, the advanced knowledge of the practitioner, and the proper procedures to make sure that the hearing aids are working just the very best that they can. That's how you can get the most out of your hearing aids and the money you spend for them.
So you really help your patients to understand all of those things when they come in.
Exactly. So it's an educational process. I think a lot of people think that hearing aid fittings are very simple, but in fact they're actually very complex, and there's a lot of different factors that go into it. So to take stock of all those factors diagnostically with the testing, and then for the function of the hearing aids, it's very important and makes a big difference in how well they work for the person.
Not all clinics are the same. Some may bundle costs, some may put things separately. How does someone make a decision about where they should go?
Exactly. The decision about where they should go should be based on where they can get the most value, expertise, and service for the money that they pay.
You really stay up on the latest technology. What are some important things that people should understand before they make an appointment about their hearing?
Hearing aids now are really complex. We use different types of technology to adjust the hearing aids and to analyze the sound that comes out of the hearing aids to make sure that it matches the prescription that the patient needs. And so for the person to know how to get the most out of their hearing aids, they need to search out practitioners that are using advanced technology like real ear measurements to analyze the sound to make sure that the sound is perfect for them.
Mm-hmm. You are a doctor of audiology, right?
Yes.
And that's an important distinction.
Absolutely. Doctors of audiology are the ones who focus at an expert level on hearing loss diagnostics and hearing rehabilitation through hearing aids or other types of hearing or assistive devices, in addition to the counseling and communicative strategies.
So this is the expert right here. This is the total package when it comes to hearing healthcare. Now hear this.
Right. We like to think so.
Okay.
We like to think so.
Thank you so much for this great education on everything we need to know about hearing.
Great. Thank you.
You can learn a whole lot more by visiting the website nowhearthisclinic.com.